Very good afternoon to everyone. On behalf of MGM Healthcare Private Limited, we are here to celebrate World No Tobacco Day. World No Tobacco Day is observed around the world every year on 31st May. This yearly celebration informs the public on the dangers of using tobacco, the business practices of tobacco companies, what the World Health Organization is doing to fight against the use of tobacco, and what people around the world can do to claim their right to health and healthy living and to protect future generations. Today, we have our senior doctors from MGM Healthcare who is going to answer us on the important questions and facts about these World No Tobacco Day. We have our Dr. M.A. Raja, Senior Consultant Medical Oncology, Director of Oncology Services, Chairman Medical Advisory Board, Dr. Balaji, Senior Consultant, Department of Surgical Oncology, Dr. Anbarasi, Consultant Radiation Oncologist, Dr. Deepika, Consultant Radiation Oncologist, Ms. Pavithra, Chezhian, Coordinator of Tobacco Cessation Clinic and Psycho-oncologist. We welcome you, doctors, to this amazing session. So to begin with the session, I would like to start my question with our Dr. M.A. Raja, sir. So is it really important to someone to diagnose with cancer, with related to quit smoking and everything, sir?
It is actually very important because, in fact, it doesn't make any sense if they don't quit smoking, because smoking could very well be the cause of the cancer that we are trying to treat. And if on the one hand the damage caused by smoking continues, then it is not going to be of much use giving them treatment. That is one point. Second, smoking is not only going to have an impact on the cancer itself, it is also affecting their heart and lung function, which can also have an impact on the way we are able to administer the treatment the way we would like. So it's very, very important that they would quit smoking at the earliest.
Thank you, sir. Now, Dr. Balaji, so what is secondhand smoke, sir? Can we get some insights about that?
Yeah, good afternoon, Vanakkam. So many of us would have heard of the fact that smoking causes cancer, smoking kills. This is an ad that comes in all the theaters. What many of us are not aware is it's not just the person who's smoking who gets affected, but it's also his immediate family. So it kills not just you, it also kills your loved ones too. So that is one of the theme that we are trying to propagate this year as well. In the sense that when you're smoking at home or in the workplace, you're going to affect all your family members, including little children who are going to be more susceptible. Now, at a younger age, when there's going to be more cell division and growth happening, tobacco basically acts by acting on the DNA. So when they are exposed to the smoke, there is going to be a higher risk that they will be having the same effect. It's not like when you inhale and you let it out, that smoke does not have any carcinogens or cancer causing chemicals. Even this smoke that is let out, that one is known as ETS or environmental tobacco smoke, or what is known as secondhand smoking. Suppose in this room somebody is smoking and I'm just sitting there without smoking also, still I am going to get affected to a major extent. There is a documented increase in lung cancer and even other cancers in patients who are exposed to long-term tobacco smoke secondhand. So this is secondhand smoke and the impact of secondhand smoke on the others who are going to be there. So for you and for your younger generation, I would advise stop smoking at home and in the workplace as well.
Thank you, doctor. Now, my next question is to Dr. Anbarasi, ma'am. Is smoking addictive? What is nicotine? Is nicotine an addictive agent?
வணக்கம், நான் டாக்டர் அன்பரசி, கன்சல்டன்ட் ரேடியேஷன் ஆங்காலஜிஸ்ட். ஸோ ஸ்மோக்கிங் வந்து டெஃபினெட்லி இட்ஸ் அடிக்டிவ். அடிக்டிவ் இஸ் பிகாஸ் இட் கண்டைன்ஸ் நிக்கோட்டின். ஸோ நிக்கோட்டினோட மெயின் பர்பஸே வந்து அடிக்ஷன் தான். இட்ஸ் நாட் அ கார்சினோஜெனிக், பட் ஸ்மோக்கிங் கண்டைன்ஸ் multiple carcinogens. So when the person becomes addictive because of the nicotine, he has more risk of developing cancer and other cardiac related morbidities, smoking related health issues. So nicotine is the major cause for tobacco induced health issues. It's not a carcinogenic, definitely. That's why even in patients who diagnosed as cancer, if patient is unable to give up tobacco, then we'll give nicotine replacement therapy so that he can quit smoking or any form of tobacco usage. So nicotine is a substance sometimes used as a medicinal purpose to stop smoking.
Thank you, ma'am. Now, my next question is to Dr. Deepika, ma'am. So, what are the types of tobacco?
Good afternoon. This is Dr. Deepika. There are actually two types of tobacco. One is tobacco by smoking. The other one is smokeless tobacco. So, tobacco by smoking, it must be like cigarettes, cigars, pipes. That are the types of tobacco by smoking. The other one is smokeless tobacco, in which we use snus, gutka, this critters, snuff. Everything are smokeless tobaccos. So everything has a carcinogenic effect. Both are very harmful.
Thank you, doctor. Now, Ms. Pavithra, can you please explain us like how is tobacco impacting our environment? Since we had a lot of discussion about like what is tobacco and how is having the impact. So, can you please explain us about how the tobacco is impacting our environment?
Okay. So the today it's known as World No Tobacco Day. So where WHO have announced it as a theme that is called as tobacco, the threat to our environment. So the whole theme is based about environment. So talking about the environmental impact, tobacco smoke either through its cultivation or the production, distribution, and the wastage from the consumers, it causes a huge impact on our environment. Talking about the what kinds of hazards that we are facing in our earth is like it contributes around 84 megatons of carbon monoxide into our atmosphere, which contributes to our greenhouse gases, and about 3.5 million hectares of areas have been under deforestation because of the cultivation of the tobacco. Followed by deforestation, again it causes a lot of soil erosion, which will harm our production of other crop yields, and a lot of pollution because of this cultivation and distribution, like in the terms of your air pollution, land pollution, and soil pollution. So altogether, these are the major concerns that affects our environment.
Thank you, doctor. And yes, my next question is to our Dr. M.A. Raja sir. So, is it very important to someone who diagnosed with cancer has to quit smoking? Is it necessary, like a person who has
Didn't you ask
already
this question
diagnosed?
before?
Sorry, sir.
Didn't you ask this question before?
That was the first question.
Yes. So since we have had a discussion about the impact of tobacco and everything, I thought let us get a little bit deeper insights about that.
See, there is no such thing as, one cigarette will not harm you. So the longer a person continues to smoke, it is going to adversely affect the health of the person. So in a patient with cancer, if we especially believe that the particular cancer itself is caused by tobacco, any benefit which is gained by treatment could be lost by the continued use of tobacco. So this cannot be overemphasized. So even at the very first meeting for all cancer patients, we take a history of tobacco use and we do counsel them about cessation of tobacco use. And if we have a tobacco cessation clinic, it will be of additional benefit to the patient. And we should also educate them about the other non-cancer adverse effects of tobacco use, which is going to directly affect their health, and it's also going to affect the cancer management as well. So definitely, yes, they should quit smoking. And in the process, we can also advise the caregivers of the patient about cessation of tobacco as a preventive measure against future disease.
Thank you, sir. Next question is to Dr. Balaji. What does tobacco do to produce cancer in human body, sir?
So yeah, இது நிறைய பேருக்கு இருக்கிற கொஸ்டின் தான். ஸோ டொபாக்கோ ஸ்மோக்கிங், whether you smoke a pipe or a cigar, whether it makes a difference. BDs are not harmful. And then, chewed tobacco like pan, gutka, pan parag, or mava, or any of these, they do not cause any impact. So this is all common misconceptions that people will have with regard to use of tobacco. Now, every form of tobacco is harmful. If you take up, there are a lot of chemicals in any form of tobacco. So it has, documented around, like 1,000 or more chemicals which are going to be there. And in that, we have almost like 70 chemicals which are going to be directly what are classified as IARC class 1 carcinogens. Now, this is an agency in France which does a study and classifies the, various substances like cell phone radiation, is it harmful? Like tobacco, is it harmful? Is alcohol harmful? Like that. They've analyzed this tobacco smoke and the contents, and also the smokeless tobacco that ma'am just now mentioned. And they find that almost 70 or 80 of them are the group 1 carcinogens or the class 1 carcinogens. So when you take this, then yes, definitely we should think about it. And how does it cause it? So most of these chemicals work through mechanism of DNA damage. All cancer causing agents ultimately work by the mechanism of DNA damage. So we have something called as formation of DNA cross links. We have 2 strands of DNA that we all know about. Normally there should be only the specified links between the 2 strands. Now there will be something called as cross link. You can think of it like a cross-talk connection madri. Nama phone lo vandu, when you are calling somebody, the number should go only to that particular thing. But here there will be a kind of crosstalk. So that crosstalk, when it happens, DNA's change will happen, and there will be a modification in the shape of DNA. The folding can get affected. So these things will ultimately lead to damage to the cells. So this in turn will lead to the development of cancer. We call them as formation of DNA adducts. There are some chemicals called as NNK, NNN. So these are the major carcinogens that we have as far as tobacco is concerned. And that will in turn lead to DNA damage and ultimately leads to the development of cancers.
Thank you, sir. My next question is to Dr. Deepika. What happens to your body like when we quit smoking, ma'am? So what exactly happens in the human body?
So there actually, if you quit smoking within 24 hours, your BP becomes normal, your pulse rate becomes normal, and your body temperature, they get back to the normal temperature. And within 3 months like that, there will be the oxygen level in your blood increases, and the cilia of the lungs, everything, they will get repaired. The ones which were damaged initially, they will get repaired. And there are and within a year or so, you can there will be a risk of coronary artery diseases that will be reduced to 50%, and even the nerve damages which has already occurred due to smoking, that might be reduced up to 50%. And within 10 years of quitting the smoking, usually it will be equal to people who are like non-smokers. Almost like 50% there will be reduction in lung cancers if you quit smoking in like 10 years.
Thank you, ma'am. So I have a pretty long question for Ms. Pavithra next. So like, how do a psycho-oncologist actually help in terms of counseling the patients, and like how does it actually help? And what are the withdrawal symptoms of smoking and how to overcome these symptoms? Can you please explain us?
Okay. So when a user, a tobacco dependent user comes in for the cessation clinic, so first we'll start with the clinical interviewing, where we'll collect all the basic information, and then we'll ask about the exposure to passive smoking, and then we'll be reasoning out about the why they are into the behavior, and then also we will check about the other influences that they have in their life, whether it's because of the peer pressure or is it because of the stress. So the area of addiction also will be noted. So for all this, we have an assessment. So we'll be assessing them through all this standardized assessment, and we'll get to know the level of dependency of the nicotine, and then their readiness to quit, like in what stage of motivation are they in to quit the tobacco, and also to understand about how it's affecting in their lifestyle. So all these will be done in our clinical interview, and followed by according to our WHO, there's a guidelines where we follow a brief intervention, which is called as 5 A's model. So here we will be talking about 5 A's. One is that the first A stands for ask. So here we will ask about the kind of tobacco they are into, and we will be collecting all the history relating to the tobacco. And the second A stands for your advice. So here we will ask them to quit. Here we will be providing the appropriate information about the tobacco, and also we'll talk about the economical welfare they'll get the benefit because of the tobacco, and the other things. So here ultimately it's more about like a psychoeducation to the client. And followed by the third A will stand for assess, where we will check about their motivational stage, and through this we'll be able to identify their relevant goals and what are the pros and cons of the quitting behavior. Then we'll be moving on to the assess, where we will help them to motivate towards the goal that they have prepared to quit the tobacco use. And here we will explore more about the triggers and the management of the withdrawal symptoms, and followed by we'll be enhancing their support system. And lastly, the arrange, the follow-up, where we will monitor the whole process. We'll reinforce the schedule and work with the client in order not to fall into the relapse. So these are the 5 models, 5 A's, which will help us for a brief intervention given by the WHO. And talking about the withdrawal symptoms, the major withdrawal symptoms are craving, insomnia, irritability, difficulty to concentrate, and few symptoms of restlessness, which can be said as a suggestive of anxiety. So these are the common symptoms we can see in the withdrawal sign. So for this, for craving, if you are talking about the major concern that comes about within the user are the craving. So talking about the craving, there's something called as 4Ds, where we will focus them more of a behavioral strategy. So the 4Ds where it stands is like, the first D is for distract yourself, and the second D is for delay your thoughts, third is deep breathing, and fourth is drink water. So these methods will be very simple to hear, but once we start practicing it, the cravings can be brought into control. So usually the cravings starts hits the hike from 6 to 12 hours a day, and followed by 3 to 4 weeks. So gradually the craving intensity will reduce day by day. So for this, there is a lot of behavioral strategies which we can help the clients to overcome, and there are a lot of intervention also where we can plan whether we have to go through pharmacological or non-pharmacological method.
Thank you, Ms. Pavithra. And my next question is to Dr. Balaji. What is vaping or e-cigarette and why it is banned, sir?
Yeah, this is again a common question that is asked, and kind of controversial question as well. Now, recently, about 2-3 years back, we had the government directive that came down saying that electronic cigarettes are banned in India, which is a good what you can say as a law that was passed. But I would be actually more happy if we banned cigarettes altogether rather than the e-cigarettes per se, because if you look at it in the scale of 10 to 1, probably cigarettes are going to be in the range of 10, whereas e-cigarettes are going to be somewhere in the range of 5. So are e-cigarettes harmful? Some of them think that e-cigarettes are not harmful. No, e-cigarettes are harmful. Now, what is this e-cigarette? Now, e-cigarette or these nicotine-based devices, like already we had Dr. Anbarasi explaining to us, the harmful substances in tobacco are mostly related to the other chemicals. So the cancer-causing substances are related to the other chemicals, the NNK, the triple N, and all that, which I already told you about. So what is the role of nicotine? All of us know that the first thing that comes to mind when we talk about tobacco is nicotine. So what does nicotine do? Nicotine induces the craving and the thedal. Like once we start smoking, that is why many people are unable to quit. So the first morning they get up, even before going to the toilet, they have to smoke. So this is like a behavioral change that happens in many patients who in many people who take up this habit of smoking. And the main substance responsible for this is going to be nicotine. But the problem is, it is not just nicotine which is getting inhaled. It's also, around 800 or 1,000 chemicals that are getting inside the body. So what we need to do to prevent this, so we can just use the nicotine replacement therapy, where we are using various forms of nicotine. It can be in the form of nicotine gum, which we already have, Nicorette, we call it common brand. So we also have other patches, other devices, everything which is going to be there. On the other hand, we also have something called as e-cigarettes, where you will have the chemical which can be inhaled alone. But the problem with inhaling nicotine is it also causes other side effects, and in fact, it has been linked to brain death and other activities as well. So that is the reason why e-cigarettes are not safe and vaping is not safe. Under controlled conditions, under medical supervision, it can be used to make a patient withdraw from smoking. That is where the use of e-cigarettes will be, but it's only under medical guidance, not over the counter.
Thank you, sir. So my next question is to Dr. M.A. Raja. So what support is required, from a family to a person who is addicted? So, family plays a very important role, and family suffers a lot if a person is getting addicted to a tobacco or a smoking habit, and it causes a lot of impact to the family also. So what kind of a support that is required from a family in terms, to help them to get
Support
away from
for the family or?
No, what support a family can provide to a person who is addicted?
Yes, see, for a person who has to quit smoking, first the person has to decide. But having decided, quitting smoking is very difficult. In fact, they say the failure rate is something like 75%. And that is because of the addictive quality. And this is where the family can play a big role. Because when somebody wants to quit smoking, the family can assist in so many ways. First of all, access to all tobacco products and related items in the house should be removed. tobacco should vanish from the house. Second, in all the situations where the person usually resorts to tobacco smoking, an alternate occupation should be provided to the person, which can be interaction with the family members and so on. They can also constantly reinforce and try to strengthen the resolve of the person concerned to quit smoking. They can also be taught how they can inform the highlights of quitting smoking, not only in terms of health, in terms of social interaction, in terms of economy, in terms of safety for the other family members. So all this they can help to highlight. They can help by drawing the family together, particularly the person who is involved in smoking together. So in so many ways, they can actually help this to become a success rather than go back to the old habits.
Thank you, sir. And with MGM, we are going to launch a tobacco cessation clinic. So I would request each doctors and our psycho-oncologists, like what as a general public we can expect from the clinic and why MGM is launching the clinic. So can I first hear from Dr. Balaji sir on that?
So yes, the role of the tobacco cessation clinic. See, already we have been discussing a lot about how to help a person quit smoking. So that is the ultimate objective of everything that goes on. Now, in this various methods that are as a routine, when patients come to us and we ask them about the history of smoking, we advise. But then that is a very kind of like a brief interview, because when the patient comes to us for cancer care, the time allotted to the patient for discussing the treatment aspect of things itself will go on for at least half an hour to 45 minutes in every discussion. And beyond that, to talk particularly about tobacco, its usage, how to prevent or how to stop this, it's not going to be in the realm of most clinicians. And this is where the role of the psycho-oncologist and the tobacco cessation clinic is going to come in. As Dr. Raja also said, like we can counsel the members, we can tell the family members and everything, but an extensive discussion, as Ms. Pavithra told currently, like the 5 A's which we do, the 4 D's which we use for withdrawal, all these can be put in a very succinct form. They can have a full counseling session where they take the full history, talk and discuss with the patient about their concerns, why they want to go ahead with smoking, or how we can help them to quit. All this can be done at the tobacco cessation clinic, where more time can be basically spent. So that is the reason why we have specialty departments and everything. So the same way, tobacco cessation clinic is a one-stop center where everything can be obtained as far as the patient. The initial assessment of how addicted they are to smoking, whether they have a willingness to quit, and if they do have it, then providing the right methods of quitting. Either it can be non-pharmacological, like just simple measures of avoiding the morning cigarette, or cutting down from taking about 1 pack of cigarettes to about half that number, or avoiding other measures like taking water instead of taking a cigarette, or having something. Providing pharmacological methods comes second, like you can use other drugs which are available. That can be the role of the tobacco cessation clinic. So in this way, a TCC or a tobacco cessation clinic is something where a comprehensive tobacco care program can be provided. And remember, this is not just for the cancer patients alone. As we all know, and Dr. Deepika just highlighted how many changes happen in the body over time and how these can be reversed. And the earliest change can start as early as around half an hour to 1 hour after we stop smoking. The BP goes up, the pulse rate goes up, your heart starts pumping more. So these are the immediate effects of tobacco, including nicotine. Though nicotine does not cause cancer, it does cause these side effects. So what we need to do is to stop smoking. And for that, the more you reinforce this, the more specially you have a department, that helps. And again, just like we have the AA club as far as Alcoholic Anonymous Club, which we have, where many ex-alcoholics get together and they share their experiences on how they were able to quit alcoholism. So the same way, in a tobacco cessation clinic, you will have motivated individuals who have already quit smoking. They will be talking about their experiences. And see, no matter how much we advise, if it is a person who has already gone through this and he is able to tell them that this is what I am doing to help with not smoking, so then that has a better impact. And these are the ways in which I feel a tobacco cessation clinic will help in the overall management of the patient.
Thank you, sir. Dr. Deepika ma'am, can we hear from you?
So basically, the tobacco cessation clinic, we have lot of time to counsel the patient. As sir told, as Dr. Balaji sir told, there will be a lot of counseling time for the tobacco cessation clinic, so that we can talk with the patient, get to know their personal feelings, and just counsel them completely, and know their difficulties, and then we can form a team, and then we can tell them how we can come out of it. So that is the main purpose of this tobacco cessation clinic. We can work as a team.
Thank you, ma'am. Dr. Anbarasi, ma'am.
So, tobacco cessation clinic is very important in not only in cancer care. ஒரு பேஷண்ட் கேன்சர்னு டயக்னோஸ் பண்ணிட்டோம் அப்படின்னா தே வில் ஆஸ்க், அவங்களுக்கு தெரியும் பிகாஸ் ஆஃப் த ஸ்மோக்கிங் ஆர் ஹிஸ்ட்ரி ஆஃப் டொபாக்கோ யூசேஜ்னால தான் வந்து கேன்சர் வந்திருக்குன்னு சொல்லிட்டேன். ஸோ தே வில் நாட் அக்செப்ட் இமீடியட்லி, எனிவே த கேன்சர் வந்தாச்சு, எதுக்காக நாங்கள் ஸ்டாப் பண்ணோம், வில் ஜஸ்ட் பஃப் சூப்பர்ஃபிஷியலி ஸோ தட் இட் வில் நாட் கோ இன்சைட், ஐ கேன் கண்டினியூ தட் சேம். ஸோ அந்த மாதிரி நிறைய நியூமரஸ் கொஸ்டின்ஸ், அவங்க ஈஸியாக வந்து அவ்வளோ சீக்கிரம் வந்து ஸ்மோக்கிங் ஸ்டாப் ஃபிட் பண்ணுறதுக்கோ இல்லை டொபாக்கோ ஸ்டாப் பண்ணுறதுக்கோ ரெடியாக இருக்க மாட்டாங்க. ஸோ இந்த டொபாக்கோ செசேஷன் கிளினிக்ல என்ன நடக்கும் அப்படின்னு பார்த்தீங்கன்னா, வி ஹாவ் அ கம்ப்ளீட் டீம் Psycho-oncologist. ஸோ ஆல்ரெடி வந்து எக்ஸ்பிளைன் பண்ண மாதிரி தே வில் அசஸ் எவ்ரிபடி அண்ட் இண்டிவிஜுவல் பேஸ்டு கேர் அது வந்து இங்கே இருக்கும். ஸோ தட் இட் வில் ஹெல்ப் த பேஷண்ட் டு ஸ்டாப் யூசிங் ஆஃப் டொபாக்கோ. டொபாக்கோ usage during treatment வந்து it impacts வந்து lot of effects on the treatment. So என்ன ட்ரீட்மெண்ட்டாக இருந்தாலும், whether it's a surgery or a radiation therapy or a chemotherapy, if they start using tobacco after the cancer diagnosis, that outcome will not be very good. So அந்த during treatment the response வந்து நல்லா இருக்காது, lot of complication will be there. So in the tobacco cessation clinic we will explain all the possibilities in detail and will counsel the patient. அதுக்கு தகுந்த மாதிரி வில் ஹெல்ப் த பேஷண்ட் அண்ட் ஆல்சோ த கேர் கிவர்ஸ், அவங்க எந்த மாதிரியான சப்போர்ட் கொடுக்கலாம் அப்படின்னு சொல்லிட்டு, அண்ட் வில் மேக் பேஷண்ட் டு குவிட் tobacco.
Thank you, ma'am. Raja sir, can we hear from you?
Yeah, see, the thing is, cancer care is now very multidisciplinary. So you could regard this tobacco cessation clinic as yet another arm of the multidisciplinary team. When you see a patient with cancer, they are already overwhelmed by the diagnosis of cancer, the possible negative implications on their life, on financial implications, what will happen to their family and so on. So there is a lot of things which they have to digest. So in the course of that, simply mentioning tobacco cessation may not make the same impact as directing them to a place where that is the main focus. So that will actually highlight to them how important it is, as much as the cancer care and all the things which go with it. That is one. Second, this tobacco cessation need not necessarily be used only for cancer patients. The cardiology doctors could use it, the pulmonology doctors could use it. So, a lot of other disciplines in the hospital can help their patients also by directing them to the tobacco cessation. It may not be confined to cancer. In fact, extending the same principle, it need not even be anybody diagnosed with any disease. It can be people in the society, it can be caregivers of the patients. It can be anybody who is now in the habit of smoking, who wants to quit smoking, and they need help. So in fact, it can become a much bigger thing than what we are envisaging right now. In its own right, it could become a department, so to speak, because it will not be dealing just with cancer patients, but also other things. So in so many ways, and also the other thing is, it is not a one-off thing. A lot of things need repeated sessions, repeated visits and so on. So it's practically not feasible to fit that into the follow-up visits or multiple visits the patients making to the oncology clinic. So they have their own schedule and sessions there independently, which are coordinated along with the cancer care visits. That way the patient is going to get maximum benefit. So, the benefits of a cessation clinic cannot be overemphasized.
Thank you, sir. So, thank you so much for all the doctors and Ms. Pavithra for joining us today on this informative session. So, we would like to see you all soon on a next informative session also. So, stay healthy and take care, all of you. So, let us get a final words from all our doctors, the wishes that you wanted to give to the general public or the piece of advice that you want to give to the common public. So can we hear from you before closing the session, sir?
You can start.
What is the
just a final
message that you want to share to the general public before closing the session?
Ideally, don't smoke. If you are, it's never too late to quit, and we are there to help you quit.
So my message will be, like the theme that we have planned for this World No Tobacco Day and this particular month and year for that matter is going to be light up our world, not your life. By lighting up a cigarette, you're lighting up your entire life and, making it go waste. Instead, light up the world. There are so many other productive things to do. We can all do that. We are there for you to help you out.
Thank you, sir. Yes, ma'am.
So just think about your loved ones. So you have to live for your loved ones and they need you. So you have to quit smoking for them. So that is the main message.
Thank you, ma'am. Anbarasi, ma'am, from you.
So, now quit smoking, not only smoking, you stop using tobacco in any forms. So, it will help not only for you, and it will help to improve the family, it will improve the society, and it improve the whole nation also. Please please stop using tobacco.
Thank you, ma'am. Pavithra, can we hear from you?
Live and let live. So any form of tobacco, it's not going to give you any benefit. Like it's like 0.0001%. So nowhere it's going to be useful. So live yourself, live a tobacco-free life, and live for your family and for the environment you are in.
Thank you. Thank you so much, everyone, for joining us. Thank you.